हो गया सर, हो गया ना स्टार्ट? Good afternoon, everyone. Today I'll be discussing about Bell's palsy. First of all, what is Bell's palsy? Bell's palsy is a form of facial paralysis resulting from dysfunction of a seventh cranial nerve that results in the inability to control the facial muscles on the affected side. So Bell's palsy एक तरीके का लकवा है जिसमें चेहरे की मांसपेशियों को लकवा पड़ता है. Bell's palsy is a disorder characterized by a disruption of a motor fibers of facial nerves, that is cranial nerve 7, leading to element type of unilateral facial paralysis. It is usually temporary, with most people making a full recovery within 2 to 3 months. It is a most common form of a facial paralysis with an annual incidence of 25 per 1 lakh annually, or about 1 in 60 persons in a lifetime. There are certain risk factors, like these patients are prone for Bell's palsy. So first one is a pregnant female and those having upper respiratory tract infections and diabetic patient. These three are the risk factors in which they are prone for developing the Bell's palsy. So facial nerve, this is a normal course of a facial nerve which starts at a pontomedullary junction and then it comes out and it enters the ear canal, and from ear canal it comes out and supplies all the facial muscles via 5 different branches. So depending upon the location site where the facial nerve is getting affected, there will be the facial paralysis. So how the patient will present to us? There are certain clinical features. Onset of facial Bell's palsy is fairly abrupt, with maximum weakness being attained by 48 hours as a general rule. Pain behind the ear may precede the paralysis for a day or two. Taste sensations may be lost unilaterally and hyperacusis may be present. It may make it hard for you to close your eyes on one side of our face. So usually patient presents कि एक तरह का चेहरे का लकवा पड़ गया है, and before that patients are usually complaining that कान के पीछे दर्द है. इसके साथ साथ वो ये भी कंप्लेन कर सकते हैं कि उनको टेस्ट आना बंद हो गया है और जो नॉर्मल आवाज सुनाई देती है उससे ज्यादा सुनाई देने लगी. So there will be on examination drooling of saliva from angle of mouth, eye problems such as excessive tearing or a dry eye, and there will be numbness on the affected side of your face. So patient will also complain, वो कहेगा कि एक तरफ का चेहरा सुन हो गया है. So this is a clinical depiction of the clinical features of the Bell's palsy. As we can see in this picture, that on the right side of a patient, there is that she's not able to wrinkle. There is a drooping of the eyelid, and patient is unable to close the right eye, and also she is unable to puff cheeks, and there is no muscle tone. At the same time, there is a drooping of the angle of mouth also. So usually patient presents with the drooping of angle of mouth, drooping of the eyelid, and patient cannot frown easily, and the nasolabial folds are lost on the site of the facial paralysis. So this is the patient is having facial paralysis on the right side. This patient is having a facial paralysis on the left side. So what is pathophysiology of Bell's palsy? Usually there is a inflammation of the facial nerve. The inflamed edematous nerve becomes compressed to a point of damage, or its blood supply is occluded, and that produces ischemia of the facial nerve and finally leads to necrosis and paralysis of the facial nerve. In acute Bell's palsy, there is inflammation of the facial nerve with mononuclear cells consistent with an infection or immune cause. And herpes simplex virus 1 was frequently detected in the endoneural fluid and the posterior auricular muscle, suggesting that a reactivation of this virus in the geniculate ganglion may be responsible for most cases. Reactivation of the varicella zoster virus is associated with Bell's palsy in up to 1/3 of the cases and may represent the second most frequent causes. And a variety of other viruses have also been implicated less commonly, and Bell's palsy can be observed in the setting of HIV seroconversion. So these are some of the certain 3 most common reasons. In infections, we can have herpes simplex, then we can have varicella zoster, and then third is the HIV seroconversion. Diagnosis of Bell's palsy is clinical. It has to be made on the physical examination and history. In some cases, we can have the mild CSF lymphocytosis. This is probably because of the inflammation of the facial nerve. An MRI may reveal swelling and uniform enhancement of the geniculate ganglion and a facial nerve, and in some cases, entrapment of the swollen nerve in the temporal bone. In uncertain cases or in atypical cases, these are the certain investigations which we are supposed to do in case of a Bell's palsy. That is ESR, CRP, testing for the diabetes mellitus, Lyme's serology, HIV serology, ACE levels to rule out sarcoidosis, chest imaging, lumbar puncture for possible GBS, and even if we are not able to find the cause, then MRI scanning may be done. These are all investigation not done in a routine case. In Bell's palsy, we can have Bell's palsy is element facial palsy, but that need to be differentiated from the human facial palsy. In human facial palsy, we are having the palsy of the lower half of the face. Upper half of the face is spared. This is because the upper part of the facial nerve nucleus is having a bilateral supply from both the cerebral hemispheres. So in case of a UML lesion, we'll have the sparing of the upper part of the face, but in case of an element facial palsy, we'll have the involvement of a complete unilateral facial nerve. These are the certain differential diagnoses for the facial nerve palsy. In nuclear lesion, we can have Lyme's disease, otitis media, Ramsay-Hunt syndrome, sarcoidosis, or GBS. And last is the tumor. But in case of a supranuclear lesion in central cause, in which we are suspecting the UMN facial palsy, the certain causes are multiple sclerosis, stroke, and tumor. Approximately 70 to 80% of patients recover within few weeks or months. Incomplete recovery is in very few percentage of cases, that is only in 10 to 12%. In those cases, we can have the complications like in the form of a hemifacial spasm, crocodile tears, jaw winking, fullness or roaring in the ears. And recurrences of the facial nerve palsy are reported in 7% of the cases. So there are certain prognostic factors like good prognosis and a poor prognosis. Good prognosis is in those patients who are having the incomplete palsy the first week, those who are having the early recovery and young age. Poor prognosis in those patients who are having severe lesion in the first few days, those Bell's palsy which are associated with hyperacusis, reduced lacrimation, advanced age, and there is associated diabetes and hypertension and severe initial pain. EMG done after the first week shows reduction in the amplitude of the facial muscles. These are the certain factors in which we are having poor prognosis. So what is a treatment? Symptomatic measures include use of a paper tape to depress the upper eyelid during sleep and prevent corneal drying. Artificial tears we have to use, massage of the weakened muscles. A course of glucocorticoids given as prednisolone 60 to 80 mg daily during the first 5 days and then tapered over the next 5 days modestly shortens the recovery period and improves the functional outcome. Along with the steroids, we are also supposed to give the other antivirals like valcyclovir and acyclovir. Although there is not a proven benefit of these antivirals, either of these antivirals can be used. Valcyclovir we give 1000 milligram TDS for 5 to 7 days, and acyclovir gives 400 mg 5 times a day for 10 days. Either of these agents should be used if vesicular lesions are observed in the palate or external auditory canal. For patients with permanent paralysis from Bell's palsy, a number of cosmetic surgical procedures have been used to restore a relatively symmetric appearance to the face. So this is a tabular representation of what treatment we are supposed to give in case of a facial Bell's palsy. Acyclovir, valcyclovir, prednisolone. These are the certain recommendation. Evidence B, we are having that patient with Bell's palsy should be treated with a course of valcyclovir and acyclovir. Patient with complete paralysis who do not improve in 2 weeks on medication should be referred to otolaryngologist for evaluation of the other causes of facial nerve palsy, and patient should be monitored for eye irritation and should be prescribed eye lubrications. Patients with corneal abrasions should be referred to an ophthalmologist. So there are certain exercises for the home care. As the nerve in the face begins to work again, doing simple exercises such as tightening and relaxing your facial muscles may make these muscles stronger and help you recover more quickly. Massaging your forehead, cheeks and lips with oil or cream may also help. So सारे पेशेंट्स को घर पे एडवाइस देना है कि उनको चेहरे की मसाज करनी है और एक्सरसाइज करनी है। एक शॉर्ट तरीके में वी कैन आस्क पेशेंट्स कि गुब्बारे फुलाने हैं, जितने ज्यादा गुब्बारे फुलाएंगे, मुंह में पानी भरना है और खुला करना है और देखना है कि कितनी दूर तक फेंक सकते हैं। आई केयर इज मोस्ट इम्पॉर्टेंट। अगर हम आई खुली रहेगी बिकॉज ऑफ बेल्स पैल्सी तो कॉर्नियल अल्सर हो जाएगा और आंखों की रोशनी तक जा सकती है। तो इसलिए उन सारे पेशेंट में जिसमें भी बेल्स पैल्सी होते हैं, आंखें बंद नहीं हो पाती है, तो हम आर्टिफिशियल टीयर्स देते हैं और रात को सोते समय जब आंख बंद नहीं हो पाती तो आई को स्टेराइल गॉज से पैच करना है। सो इफ यू कैन नॉट ब्लिंक और क्लोज योर आईज फुली, your eyes may become dry. A dry eye can lead to sores and serious visual problems. To help protect the eyes and keep it moist, use your finger to close and open your eyelids often throughout the day. Use eye drops or ointment. Those that contains methyl cellulose are a good choice and don't require a prescription. You may want to use drops during the day and ointment at night while you sleep. Ask your doctors how often to use the drops. Wear an eye patch while you sleep and wear glasses or goggles during the rest of the time. So these are the certain complications that patient can develop: eye sore, irreversible damage to the facial nerve, abnormal regrowth of the muscle fibers, partial and complete blindness of the eye. अगर ट्रीटमेंट दवाई से ठीक नहीं हो रहा है तो उसमें सर्जरी की जरूरत भी पड़ सकती है। सर्जिकल ट्रीटमेंट comprise of the surgical decompression of the facial nerve. It is very important to select the time to do the surgical intervention. In majority of the cases, recovery is invariable, so it is preferred to give at least 8 weeks of medical treatment including the stellate ganglion block before going for a surgery. Electroneuronography is done nowadays, which when shows 95% of the nerve degeneration, then surgical intervention is done. So these are certain surgical procedures: nerve substitution, facial nerve repair and nerve graft, and muscle transposition. These procedures are not able to completely restore the normal functions, but they can significantly improve the facial function and appearances. Thank you.